Let me start off by introducing our team. My name is Katie Shaw. My team members are Jason Tinbarge, Joy Dunas, and Patrick Elvers. Well, let's start off talking about hospitals. I'm sure everybody in here has been to a hospital, whether you were admitted yourself, it was a friend, a family member. You've probably noticed when you're in a hospital that there are varying levels of care, varying levels of requirement for each patient. And what we found for patients that are incapacitated and require long hospital stays is a high prevalence of bed sores. So let's talk about the problem of bed sores. Over 2.5 million people are affected by bed sores every year, and 60,000 people will die from bed sores each year. Why is this important? Well, if you look at this slide, you can see the costs range from between $20,000 to over $150,000 per bed sore. Again, this is huge, but why is this important? Well, hospitals incur the cost of any bed sore that develops or worsens while the patient is in their care. Third party and insurance does not pay for it, so Medicare or Medicaid, nobody pays for that. The hospital pays for it. Please work. Okay. Now here I have a graphic. Let me provide a little backstory before I explain this graphic. We went and spoke with Linda White, who is the president at Deaconess Hospital, and she introduced us to several nurses that work at the hospital, specifically people who work with patients who have bed sores. Now, currently, what happens is that the nurses go in and they examine the patient physically. So what they'll do is they'll look at the site, they'll assess the patient's nutrition, the patient's health, and they will score them on what's called a Brady score. Now, we're not looking to replace this physical examination. What we're presenting today is an ability to monitor and detect bed sores as they develop. So kind of in addition to this physical examination. Now, what we're proposing is called Smart Clock. And basically how it works is from the nurse's station, you see our pretty nurse over here, she can monitor, or he can monitor the patient in bed. So what happens is that we are going to create this map that is bed size that will monitor both, monitor both temperature and pressure. Now, when we talked to the nurses at Deaconess, they said that the three most important things when looking at bed sores are pressure, temperature, and humidity. Now, we will be looking to further develop humidity into our product. However, that is a future research and development project. So you can see from here, they take the pressure and the temperature, and it monitors automatically to the nurse's station via the computer that's in each room. So the nurse automatically gets that information, and they can automatically make adjustments to their patient as needed or adjustments to their position or requirements. I'm not very good at this. Okay, here's a visual representation of our smart clock. Now basically what I did was just display the pressure sensor part of it for right now. Now this is a velostat, and each layer has layers of wires which create a grid. Now as these grids are pushed closer together or farther apart, they change the pressure that's displayed on the monitor that goes to the nurse's station. So these layers have just kind of been slid apart so that you can see the different layers. Some benefits of our smart clock. Well, as I said before, early detection. Since it's real-time monitoring, the nurse can make real-time adjustments and real-time care differences as needed. Also, will significantly reduce costs for the hospital by monitoring the bed sores as they occur. Early detection means that the nurses can get in there, they can care for it before the hospital has to incur the costs of the bed sore developing. Clearly, we'll improve patients' health through this method, as well as will provide a competitive advantage in costs. Now, the current models that are on the market right now generally are incorporated into the beds themselves, and they can run thousands of dollars. We're talking $8,000, $9,000, $10,000 per bed. And what we're proposing is mere hundreds of dollars, and you'll see that later in our financial analysis. Now, a couple of potential obstacles that we found was potential obstacle of implementation and training, as well as adaptability. But we really feel like that we have answered these obstacles. We've really provided some clear pathways, one of which being our sales team. Face-to-face sales at the hospital. Again, you'll hear a little bit more about our specific sales requirements and what we'll be doing as a team, but also a simplified user interface. The nurse at the nurse's station will have a very simple output for which they can assess their patient's needs. And also for adaptability, we have free trial periods. One of the things that we learned when we went to talk to Linda White's team of nurses is that before they will buy something for the entire hospital, they buy one and they test it on themselves. What they learned is if they don't like the product, their patients aren't going to like the product. So they try to make sure that the product is what the hospital needs and what the hospital wants. And then also providing credibility for the hospital, as well as some scientific evidence. They'll be really incorporated into our process of research and development. Again, that'll be discussed later in our business model. And now I'll hand it over to Patrick Elpers for some industry analysis.
All right, thanks, Katie. So, as Katie just talked about, she expressed the problem and pain with bed sores and the product that we want to implement to solve that problem. As we went on with that, we kind of wanted to know if the market was ready for something like this. Is it feasible in the industry? And so, starting off, we wanted to look at the health of the industry. With healthcare itself, it's obviously a mega trend. More people are going to need healthcare, and there's going to be less nurses to do it. So there's definitely a trend in that area. As far as bed sores go, from 1993 to 2006, bed sores have increased by over 80%. So even just bed sores are increasing. And again, our product can take advantage of that. As far as the opportunity size of the market, again, healthcare is going to be a very healthy industry, a lot of money out there. Again, with bed sores themselves, in 2006, $11 billion was paid by hospitals when bed sores were either a primary or secondary diagnosis. And as Katie said earlier, a lot of times hospitals have to incur this cost. And with our product, they can get rid of a lot of that cost and just prevent them right away. So we've talked about it's feasible in the market, it's a good idea. So we went on with our business model. And this is just kind of a quick schematic of what we're dealing with our business. I'm going to talk about the internal side of our business, the key resources, key partners, and key activities. And then I'll turn over to Joey. He'll talk about the external side, with the customer relationships, channels, and segments. And then we'll go over our financials. And all the different areas will be color-coded, and we'll have our business model, again, seen down here in the right corner. Starting off with the infrastructure of our business, we have the key resources. Obviously, the patents that we're getting from Crane is going to be a big resource that we're going to be working with, as well as software and content integration in an IT platform. Each different hospital will have their own program that we'll need to integrate with our product, and so that's another resource that we'll have to provide. Our key partners, again, Crane will be working with their patent, so we'll be developing our product with them, as well as a manufacturer. We're not going to be manufacturing this product, so we'll have to partner up with someone who we also hope will do the shipping, and so we can kind of cut down on costs there too. Our key activities, this is where we'll be making the money. The big area will be the marketing and sales. We're going to have a sales team that will go out to the hospitals, show them our product, and get them interested and do all the sales that way. We'll also have a website with how big the internet is, and just Googling it. We want our product to pop up and show them what's out there. Also, nursing school collaborations. By offering our product to nursing schools, we can get nurses excited about this product. They can go to hospitals, say, hey, there's this cool product out there. They already know how to use it, and just doing the marketing that way is a big deal. Also, customer support is another big activity that we want to do. Assistance with implementation, as well as maintenance and troubleshooting. Just making sure that we keep those relationships healthy and that they're happy with our product is a big deal. And then finally, research and development. As Katie stated earlier, our phase 1 product will probably just have pressure and temperature, and we want to eventually implement humidity or moisture, something like that. And that's just a continuing improvement of our product. So those are our key activities, and as I said, now I'll turn it over to Joey to talk about our external side.
Thanks, Patrick. So Patrick just showed you how we're going to create the value for our customers. Now I'm going to show you how we're actually going to deliver this value. Now for the customer relationships, what we're going to do is for every sale to a hospital, we're going to offer free trial periods, as Katie mentioned, and then we're going to gather feedback from each of our sales representatives and then adapt to any of the customer demands. So anything that the hospital says that they want changed, we're going to adapt immediately, and this is going to help build customer relationships. Now, how we're actually going to reach our customer segments. For hospitals and nursing homes, we're going to have a sales team to go around for face-to-face selling, as Katie mentioned, and also we're going to have a website, so it's easy to get on. The internet's big these days, so people can just get on, Google search, find our product. And also, as Patrick mentioned, nursing school collaboration is also going to be another channel for us to reach our segments. Now, just to reiterate, our customer segments are hospitals and nursing homes, and then eventually the patients will be the end users. It's going to be passed down from hospitals and nursing homes to nurses and caregivers who eventually will give it to the patients who will benefit the most from this product. Now, for our financials, what we did so far is we have startup costs for 3 months, and this is going to cover the first 3 months, and these are going to be the total required funds that we're going to need. For fixed assets, we have patents and equipment total around $25,000. For operating capital, we use several different aspects such as salaries and wages, R&D, insurance premiums, legal and accounting fees, rent deposits, supplies, advertising, and a little bit of working capital to have some cash on hand to cover any unexpected expenses. So the total required funds that we came up with is about $258,000 for the first 3 months for startup costs. Now to simplify this, if I can get this together. There we go. To simplify this, I'll just give you a little bit of a chart, and as you can see, operating capital is the major part of this, $232,000, with fixed assets taking up a little bit of the chunk at $25,000. And again, just to reiterate, a total required funds for the first 3 months of $258,000 to get on our feet and get going before we start making sales. And now I'm going to hand it over to Jason, and he's going to give you a little bit further in-depth analysis of our financials.
So you heard about our problem, about bed sores, and how we hope to prevent that problem. And we also showed you how the industry is growing and our business model to help this happen. Well, now I'll talk about the financials and kind of our yearly expenses and everything like that. So this is our sales forecast. What we did is we figured out how many hospital beds there are in Illinois, Kentucky, and Indiana. And then we took 10% of that, which we figured are the hospital beds for ICU. And then we took 25% of that. So really it's only 2.5% of all the hospital beds in the tri-state area. And then, but we'll also be targeting nursing homes and other things of that nature. So we come up with 1,600 beds for the first year. And these electronic mats will be selling for $400 per unit. And then we'll also be selling a cover that goes over the mat. As things happen in the hospital, blood might get on them or whatever, so it's good to have a cover that they can wash and everything like that. And we'll be selling that for $1,500. Now the cover will last about 300 washers or so, and then they'll probably have to buy a new one from us. And then our first year expenses, our key personnel, as any business, the expertise in the business is what really drives it. And we're going to have us 4 and then 2 more people who can help us with the industry and the engineering and all that for $326,000. And then our actual business expenses is only $234,000 for a combined of $560,000. And then our income statement. So for our sales forecast, $400, $640,000 for the mats. Comes out to $690 altogether. And the mats themselves cost $100 a piece, with the covers costing about $1. So this comes out to $153,000 of cost of sales. Then our expenses I showed earlier is for only a net profit of, a net loss of $23,000 for the first year. But I'll show you in a bit that we hope this will increase to the positive later on. So for our sales forecast, we are increasing our projected sales about 5% per month. We feel like this is achievable, at least at the beginning, and then later on it'll calm down. But so our revenues come out to about $2,326,000 for the third year, and then you can see as our net income increases too. For $124,000 the second year, and $485,000 the third year, and so this brings a return on investment of 34% annually. And then just as to show you how much, how it works, basically, the break-even sales for the first year would be $720,000. So just as an overview of what we're hoping to achieve with our business, a more efficient allocation of resources for the hospitals, as we'll be able to tell nurses when people need returned, if they need to be inspected, and so that nurses don't have to do things they don't need to do, but also tell them to do stuff when they forget about it or whatever. And then preventing bed sores. So by telling nurses and everything that, you know, someone might have a bed sore, hopefully they can, you know, treat them early on so that it doesn't come out to be a really bad thing. And then reducing costs that way, as prevention is a lot better than treatment. So any questions?